Hi everyone, I am Dr. Anita, your fertility consultant from Garbhagudi IVF Center. Today we'll just have a quick look about the female infertility. So infertility is defined as the couple unable to achieve pregnancy even after trying for 1 year. So these couple will have lots of social pressure from friends, relatives, family, and especially the blame game shifts onto the female partner. The female partner will have so much of pressure, and the couple will be hesitant. They will have lots of social stigma, especially the male partner. They will be hesitant to go to the doctor or the hospital, especially for fertility issues. So what can be the causes? The causes, never even think that it's only the female causes, and don't think that men cannot be reason for infertility. The causes are equal. That is, if the causes from female is 30%, means men are responsible for 30% of the infertility, and both men and women will be responsible for another 30%, and rest 10% is unexplained, where the cause itself cannot be diagnosed with the basic investigations. So coming to the female causes can be from the ovary, uterus, or it can be from the general causes also. That means it can be irregular ovulation, that is anovulatory causes leading to like in the irregular menstrual cycles, irregularly secreting the ovum, and then uterine causes like fibroids, polyps, uterine abnormalities, uterine anomalies, and many like adenomyosis or endometriosis. It can be tubal factors, that is fallopian tubes getting blocked. The blockage reasons can be infections, or it can be again anatomical causes, or it can be congenital reasons also. So mainly ovary, uterus and the fallopian tubes, and for men it can be abnormalities in the semen analysis. So how to go about? First thing is, couple without avoiding the social stigma first has to approach the doctor. So go meet your doctor, get evaluated. Thorough evaluation, that is complete physical examination and investigations. The investigations include basic, baseline, general blood investigations, specific hormone investigations, and ultrasound. And for man, it is only semen analysis. After going through all the investigations, we'll be able to locate or find where the pathology is, and depending upon the pathology, we can address the issue and go for the treatment. If there is problem with the ovulation, so address the ovulation issues. If there is problem with the uterus, that is, it can be fibroid, polyps, septa, or anomalies. So if such issues can be corrected surgically, then they will conceive. If tubal pathology or tubal blockage can be diagnosed with a basic simple test like HSG, hysterosalpingogram, where it can be diagnosed by simple dye test, or in case of advanced evaluation required, we can even go for laparoscopy. So, and semen abnormalities. So coming to the treatment part, once we diagnose these causes, go for the treatment part. Treatment doesn't include only medications. Don't ever think if we go to the doctor or the fertility hospital, they are going for medications, they'll always suggest IVF. Never even think like that. So other than IVF, there are other modes of conception like simple ovulation induction if there is ovulation abnormalities, or intrauterine insemination where there is some other pathology with the male factor. So first treatment is concentrate on the food, that is healthy fruits and vegetables, and more of homemade food than eating outside food. Avoid canned, frozen food, instant food, or ready-made foods. These are more harmful than doing good for you. Include more of fresh food like fresh fruits and vegetables. If you are a non-vegetarian, you can include poultry or meat also. More of protein-rich food. And then coming to the lifestyle, once we address the food, in the food, not only the solid food, concentrate more on the liquids. Like how we say an apple a day keeps the doctor away, we also should think more of fluids. More water keeps the doctor away. You are more healthy if you consume more of fluids. Coming to the lifestyle, that is having the sedentary lifestyle, that is sleeping late, waking up late, and awake, like the sleep rhythm getting disturbed, all these things. And lazy lifestyle also. Sedentary means lazy lifestyle. So at least exercise, you should follow a strict exercise of at least minimum 1 hour. That is, start with half an hour or 20 minutes also, and slowly, gradually increase day by day. 5 minutes every day you increase. It can be walking, swimming, skipping, or aerobics, or even yoga, stretching exercises. All these things also can be included in your lifestyle. Lifestyle includes not only exercise, food habits, and even the wear also, like wearing of clothes, too much of tights, too much of external cosmetics, too much of deodorants, too much Wi-Fi exposure. All these things has to be avoided. Men especially have to avoid tight jeans, smoking, alcohol. Men means even the women also. The healthy habits, that is too much of alcohol consumption, smoking, outside food. So all these things has to be avoided. So after food and lifestyle, we'll come to the specific treatment. Once the cause is identified, so specific treatment. If there is tubal pathology, if there is tubal blockage, we can address the blockage, try to open up the tubes if it is possible. Otherwise, go for the alternative method. If there is short cervix or some cervical pathology, then we can go for intrauterine insemination. Or if there is uterine abnormalities, surgical correction can be done. If there is infection, then specific antibiotics or other treatment modalities can be taken care. So ovulation abnormalities we can address with simple issues, like we can give some simple medicines which induces the ovulation, and we'll follow the regular cycle. We'll be counseling about the fertile window, and then intrauterine insemination, where the husband semen will be collected, washed, and the good quality semen will be deposited into the uterus close to the tube where the ovulation occurs. So this will help. Almost more than 15% will conceive like this through intrauterine insemination. And if there are multiple or other advanced pathology is found out, and if we find so basic modalities may not help these couple, then we might suggest for in vitro fertilization, where they have to go for advanced methods of treatment. And this will definitely help the couple to achieve their pregnancy as well as dreams. So don't hesitate to go for evaluation and treatment. Thank you.